and anal glands. So I have my finger with gloves, lube, and paper towel. So I'm going to stick my index finger into his rectum and feel for his anal glands. So once I feel for the anal glands, I'm going to express. That's the one side. And then I'll push in my thumb externally for the other side. You can see that there's contents there. And then I'm going to take baby wipes across on the other side table. And I'm going to take baby wipes. And clean his bottom so it does not linger in the exam room. Okay. This is Ashley Anderson, and this is task 29, nail trimming on, or not 29, 28, nail trimming on a dog. So he's in lateral competency with my assistant holding him. I have Styptic pattern nail clippers. So he's got black nails, so I'm going to take a little bit off at a time until I see the little black dot. And then get these dew points. Good boy, Bowser. There you go. She didn't. You can see here that he reacted, but he did not get quite. Yeah. Okay, and that's it. This is Ashley Anderson. This is task 29, clipping Kitty's nails. So I have the cat here placed in lateral competency by my assistant. So I'm going to press the paw here, and you're going to clip it right before you get to the quick, which is the pink part, and so you just get the tips. You're going to make sure that you don't hit the quick. If you do hit the quick, then you can apply the Styptic powder, which I have right here. And then you always make sure you get the dew claw, which kind of hides right here. And then you're going to do this for the remaining of the feet. This is Ashley Anderson, and this is task 30, cleaning a canine's ear. So I have my assistant here restraining my dog. I have ear cleaning solution and cotton balls. So what I'm going to do is I'm going to open his ear. I'm going to put a sufficient amount of solution in his ear, allow some to drain, and then with the cotton ball kind of dry it out and making sure that the cotton balls are clean. So without the vial tip touching his ear, I'm going to insert some in here. And then there's a good amount because I can see it pouring out. I'm going to let it drain some. Let me shake. There we go. And then with the cotton ball, scoop out until it's clean. You don't want to go too far in the canal, but you want to make sure you get in all the creases and folds to get. And I'm going to repeat that on the other ear until till the cotton ball becomes clean, and then you can see inside here there's no debris that's left. This is task 31, cleaning and medicating a cat's ear. So I have my assistant here holding the cat. So the first thing I'm going to do is I'm going to put the cleanser in his ear. I'm not going to let the vial tip touch the inside of the ear. I'm going to make sure there's a sufficient amount in his ear. So I'm going to pour some in his ear. I'm going to let it get in there. There's a sufficient amount. Let him get some of it out.
Oh,
And then
he's such a good cutie.
I'm going to clean the inside of his ear with cotton balls. Not going in too deep, making sure I'm scooping out all the debris. And I'm going to do it until there's nothing left on the cotton ball. And then you can look inside his ear here and see that it's clean. And if I had a medication, I would administer it at this point with the same principle of not letting the vial tip of the ear medication touch the ear. This is Ashley Anderson. This is task 32, hand pilling a dog. So I have my patient's chart here. So the doctor ordered 10 milligrams of famotidine to be given PO. So I want to make sure that I have the right drug, which I got from the famotidine, the right drug, so it's the right dose and it's the right route. So I have all the rights. So double check his chart one more time, make sure this is Rufus. So with Heather holding him, just gonna hold him. I'm gonna open his mouth here and I'm going to shove the pill down, and then I'm going to administer a small amount of water to make sure that he swallowed it. I'm going to check to make sure that there's not hiding in his lips anywhere. So it looks like he got the full pill. This is Ashley Anderson, and this is task 33, hand pilling a cat. So I have my cat here. I have his chart. So he is due for mirtazapine, half a 15 milligram tablet by mouth. So I'm verifying it's the right pet with the right drug and the right dose, which I did. So the first thing I'm going to do is have Heather hold him. And I'm going to open his mouth, shove the pill down his throat, and then squirt some water in so it goes down. All right, so you can see that the pill went down. He's not spitting it out, and it's all the way through. Task 34, I'm going to place the stomach tube. So I have a cadaver here. So the first thing I'm going to do is measure the tube. So this is the end of the tube. I'm going to measure it from the canine to the last rib. So here's the last rib here. The canine that's here. So it's right here. I'm going to mark it with tape. Then I'm going to place a mouse speculum here, like this. I'm going to lube the end of the tube. And I'm going to insert it gently into the patient. Until I get to the line. So I'm to the line here. I can feel it in the throat. So if I were using an alive patient, I would put 2 to 5 mLs of sterile saline down the tube and wait to see if he coughed to make sure it was properly placed. Another thing you can do is take a radiograph if you want. Then I'm going to inject the medication into the tube.
No, but his are done.
So all of the medications going in here. And then before I withdraw the tube, I'm going to kink it and then pull the tube out like that. And there you go. This is Ashley Anderson. I'm going to simulate how to do an enema on a dog. So I have my cadaver here. So he's at the tub sink for cleanliness reasons. I have my tube, so here we use red rubber. So, you know, it's 2 to 3 inches for the rectum to the dog. My doctor prescribed 35 cc's, so it's a mixture of water. It's water with 2 tablespoons of lubrication and 1 tablespoon of water. So we connect it to this end here. Then we're going to lubricate this here. Then if I was going to put this in the rectum, I would put it in the rectum up here. I would wait for it to be all the way in the rectum, then I would remove the entire contents of the syringe, and then before I would make sure it was all empty. Then I would pull out, and then I would sit here and I would watch for the evacuation. It tends to happen really quickly, and then I would assist in cleaning up afterwards. This is Ashley Anderson, and this is administering sub-Q injection on a dog. So I have Rufus here. I have the medication here. It's supposed to be 0.2 mLs of Cerenia to go sub-Q. I'm going to double check it in his chart here to make sure that that's what it's supposed to do. So I have the butorphanol 0.2 mLs to go sub-Q, and it matches. So with Lindsay holding him, I'm going to make a little skin tint here so I can get underneath the skin here. So he's got lots of room here. I'm going to uncap the needle. Then I'm going to inject it in. I'm going to pull the plunger back to make sure there's no blood, and then I'm going to bring it in, just like that. Good boy. Good boy. Yo. Just a good boy, Mama. I'm sorry. I know. Ruby cookie. This is Ashley Anderson, and I'm going to give a sub-Q injection in a kitty. So we have our patient right here. So I have some medication here, Cerenia. So it's 0.2 mLs that I'm going to give sub-Q. I'm going to look in this chart here to verify that it is Bowser. Dr. Young ordered to do 0.2 mLs of Cerenia sub-Q. So what I'm going to do is, with Lindsay holding him here, I'm going to tint his skin right up here, so where the sub-Q is. I'm going to inject the needle in like this. Oop. Yeah, Bubba. There we go. Pull back. Boop. There we go. Pull back so that there's no blood, and then inject it in like this. Good boy.
What do you think, Bowser?
This is Ashley Anderson, and this is administering an IM injection in a dog. So I have my patient's chart here. I'm going to double check. So I have dexdomitor, 0.23 mLs, and I've confirmed that on here. To go IM for Rufus Anderson, so that's him right here. So we're going to sedate him for a bandage change. So there's a couple different places you can do an IM injection. I'm going to do it back here in his biceps. So I'm going to feel for the muscle right here. Then I'm going to uncap the needle. I'm going to insert it into his muscle. I'm going to pull the syringe back to make sure that there's no blood, and then inject the dexdomitor there and rub it off. Okay.
Go to sleep, Rufus.
I'm Ashley Anderson, and I'm going to give an IM injection. So I have 0.1 of dexdomitor.
Bless you.
Excuse me, he's a little nervous that he's shedding a lot. So you can see it right here. I'm going to double check it in his chart. So I have Bowser, who gets dexdomitor 0.2 mLs authorized by Dr. Young to give IM of the dexdomitor. So I'm going to go right up here where his bicep femoris is, and I'm going to insert it in here. Then I'm going to pull the syringe back to make sure there's no blood, and then I'm going to inject it in. Good boy.
Good boy. Good boy.
This is Ashley Anderson, and I'm going to do an IV injection without being with Rufus here. So I have Rufus here. I have 0.18 mLs of dexdomitor. So I'm going to double check his chart. That's right here. I'm going to make sure it's the right patient with the right dose and the right route and the right drug. And so all of those match on his chart. So with Lindsay holding him, I'm going to clean it with alcohol here. And going to here for his vein. There we go. Bevel side up, I'm going to insert it. So I have blood blood right here, you can see. And then I'm going to inject it in slowly while Lindsay lets up. And then she's going to hold it off. There you go.
Good boy. You did great.
Good boy. That's the greatest boy in the world.
You did great.
That's the greatest boy in the world. You want a cookie? Oh, you
Yes.
mad at me?
Cookie.
I hate doing it. I feel bad I didn't get the first crap. My name's Ashley Anderson, and I'm going to give an IV injection for the cat. So I have dextromethorphan here. I have 0.11 mLs. I'm going to double check his chart here. So it says to do dextromethorphan 0.11 mLs IV for the right patient, the right dose. So I'm going to get it wet here with alcohol. I'm going to palpate his vein right here. Then I'm going to insert the needle double side up. And then I see a flash here. And so I can pull back and you see there's blood right there. And then Lindsay's going to let up and then we're going to inject it in.
Beautiful. Good boy, Bowser. Good boy.
Last one. This is Ashley Anderson. This is task 42, administered sub-Q fluid. So I have Rufus here. Dr. Young wants 20 mLs of Normosol sub-Q. So I'm going to go over here to his chart. So I have Rufus, 20 mLs of Normosol to be given sub-Q. So I've double checked that it's the right patient, and the right route, and the right medication. So I'm going to pull up 20 mLs of the Normosol here. So you can see I have 20 mLs. So with my assistant holding him, I'm going to lift up this skin around his neck, insert the needle. So here's a good spot. Insert the needle, aspirate back to make sure I'm not in a vessel, and then inject. He's a good boy. Then I'm going to massage it in. So you can see right here, it's got a little bump right here, a little quasi-modal, and that's where the sub-Q fluids are. This is Ashley Anderson. This is task 43, placing a cephalic catheter. So I have my patient here, my catheter supplies here. I have tape, flush for the catheter, flush for after placement, different catheter sizes, tourniquet, scrub, and clippers. So I'm going to have my assistant here extend this leg out and roll the vein. And I'm going to clip here so that all the hair is all around is removed. Move the hair out of the way. And then I'm going to scrub it 3 times. And then the last one, I'm making sure that it doesn't touch the hair above or below where I'm going to put the catheter in. Okay. So I'm going to remove the catheter. So I'm going to take the end and I'm going to flush it with heparinized saline. Heparinized. Then while I take a gauze square so that it doesn't contaminate the site, I'm going to insert the catheter bevel side up and thread it in. Mitchington. So you can see it flashed. Then I'm going to thread it. Then I'm going to take an ejection cap, place it here. So I'm going to take my tape and tape it underneath. And then secure it under here. While holding on to the leg here. Then we secure the T-set with another piece of tape. Then I'm going to flush at least 2 cc's in of heparinized saline to make sure it's patent. Can you feel it? So you can feel it. Then we secure the T-set with another piece of tape. Then we clamp it off and then we secure it with a piece of vet wrap. Like so. And there's IV catheter. Some complications of IV catheter placement is phlebitis, infection, hematoma. Also, if it's not incorrectly, you can actually flush it into the sub-Q, and therefore the drugs that you administer for anesthesia, which can necrose underneath the sub-Q, can cause that. You should check the IV catheter every 4 hours to flush it to make sure that it's not clotted. Sometimes animals chew them out, sometimes just randomly they just, for some reason, they get kinked. So it's important to check that. Also, if you're running IV fluids, so you're not getting a big fluid bolus underneath. And to reduce the risk of patients pulling them out, e-collars, vet wrap, catheter guards, and also just using your eyes and keeping an eye on them so that they can't pull it out. This is Ashley Anderson. I'm going to place an IV saphenous catheter. So I have all my supplies here. I have tape, I have flush for when the catheter is placed, then I have flush here for when I flush the catheter before placement, scrub, clippers. He does need blood, so I have the tubes, the syringe, and the clippers. So our Jenny and Brandy here are going to help me put them in lateral recumbency.
Come on, Benjamin. Let's go. All right, sit, buddy. You sit. Sit. He's like, no. Don't want to push. Sit. All right. Then we'll just 1, 2, 3. 1. All right. There you go, buddy. It's okay. It's okay, baby.
I'm going to clip the area first. He's got the short hair, so I'm going to do very slowly so he doesn't get clipper burn.
Boy. It's all right.
And I'm going to clip all the way around so that the tape doesn't get stuck. Good job, bud. Nice job. Then I'm going to scrub. First, I'm going to move my tape over here so it's more accessible. And I need one gauze.
You got your tubes?
So I'm gonna start with the alcohol. I know it's cold.
Buddy.
Sorry, buddy. And then on this last one, I'm just gonna go over where I'm gonna poke without touching the hair. Then I'm going to take the catheter, I'm going to open it, then I'm going to flush it with saline. And I'm going to take this other gauze to prevent contamination and put it right here. And I'm going to stabilize the vein with my thumb. Insert the catheter bevel side up.
All right, buddy. Hang in there. It's okay. Good job.
So I have a flash, and then I'm going to thread the catheter through. And because he needs blood work, so we don't have to poke him again, I'm just going to attach this syringe here.
Good boy.
And pull back. And I'm going to unclamp it. Then I have my T-set here. I'm going to place the T-set on. And now I'm going to tape it in. So my first tape here is going to go under the hub. And you want to do it so it lines up with the vein so you don't kink it. And I'm going to make sure my T-set is secure. Then I'm going to do it right underneath here.
Very good boys.
And I'm going to secure the T-set. Then I'm going to flush 2 mils of saline, and it's flushing good.
Pull it up here too.
And then I'm just going to secure the hub here. And the last thing I'm going to do is cover it with vet wrap. That's how you place the catheter. This is task 45. I'm doing a tear test on the dog. So I have the strip here. So what I'm going to do is I'm going to fold this part in the package. This is the part that I'm going to put on the lower eyelid. And so what I'm going to do is I'm going to open it, and I'm only going to touch this very end part. That's not where it's going to touch. It's not going in the eye. So I'm just touching this very end part here. So with my assistant holding the dog, I'm going to place this in the lower eyelid like that, and I'm going to hold this closed. Hold this closed. There you go. All right, and I'm going to hold this closed for. I'm going to hold this closed for 60 seconds. So you want to make sure that it stays closed and that you're not touching the part that's in his eye. So you have to hold it closed here. It's in the lower eyelid, and so we're essentially waiting to see if it would when it tears. And the indicator is on the strip, or how many seconds. So we're about halfway there. You're being a good boy. So about 20 more seconds. All right, so it's been a minute. And then what we do is we measure how it's changed. Like that. Okay.
Good.
This is Ashley Anderson. This is task 46. I'm administering eye drops. So I have my eye drops here. So I have Rufus here. Sit, buddy. Sit, Rufus. Sit. Good
Come on,
boy.
buddy, sit.
So without the vial tip touching his eye, I'm going to place it in the corner of his eye here and drop a few drops. Then I'm going to do the same with the other eye here. Perfect.
Good job.
This is Ashley Anderson, and I'm going to do task number 47, the fluorescein dye test. So I have my strip here. So I'm going to open the strip here sterilely. And I'm only going to touch the part down here in the end that's white. Then I'm going to take eye wash, and I'm going to moisten the strip here. And then with Heather restraining, I'm going to lift the upper eyelid, and I'm going to place it right here. Then I'm going to flush the eye liberally. To remove any excess stain. Sorry. Okay, so we have the excess removed. Then I'm going to use a black light to look to see if there's any stain uptake in the eye. So you can see here that there's no stain uptake. Everything, you can see it in the conjunctiva where it collected, but nothing on the corneal itself. Another thing that you can check to see right here is how the ducts are and the sinuses are. So you can see that his is working pretty well because you can kind of see it here how it got on his nose. And so that's how you do it. This is task 48. I'm going to do a pressure reading on an eye. So the first thing I'm going to do is I'm going to look at my pen, make sure my pen is functioning. So we keep our pen in here. So to turn it on, I just push this button and it's already calibrated. So what we do is we have these protective coverings here, and I'm just going to stick that here and then take this plastic part off. I'm going to numb the eye first, so we're going to numb it right here. So I'm going to place 2 drops in the eye, and I'm going to wait a minute for it to take effect. This numbs the eye. So what you do with the pen is after the eye is numbed, you're going to put this tip on top of the cornea, and then you're going to press here. It's going to beep once, twice, and you'll get the reading. You do this 3 times, and you take the average for the average pressure. So we still have about 30 seconds. So it measures the pressure in the eye. One condition that can cause higher pressure in the eye is glaucoma. So sometimes dogs with diabetes have that. Sometimes dogs with brain disease have higher pressure in their eye too. So we have about 15 seconds left. So this just timed out naturally, so I'm just going to start it. And as soon as this zeroes out, we're going to be ready to go. Okay, so I'm going to press it here, 1. So we got 1995, and we're going to do that 2 more times. And this just takes a second for it to calibrate, so you have to wait for the 3 lines here when this light goes off. Okay. Okay, so that one was 20. And that one was 19. So you take the average, so it'd be 19. I get a calculator. So I'll just use the one on the computer. So eventually I'll get to there we go. So the average would be 19 plus 19 plus 20 divided by 3. So it'd be 19.3. And that's how you do it. This is Ashley Anderson's task 49, putting on a modified Robert Jones bandage. So I'm going to do it on this forelimb here. So the first thing I'm going to do is make some stirrups. So the first thing I would do is if he had a lesion, I would put a Telfla pad, which is a non-adhesive pad, on the wound. So let's say he had a wound right here, then I would put the Telfla pad on first. First thing I start is I start at the distal and go up with the soft cast padding. So with his extended like this. And you want to roll it in a way that his 2 middle toes are showing. So this cast padding is designed that you can stretch it and you can't do it too tight because it will rip. And so you want to do at least 2 layers. And I'm just going to use the end of this roll just for an extra padding. So I have 3 layers here. And the next thing you do is you do cleaning. So this kind of just helps put it, hold it in place. So I'm stretching it. And then I'm going to grab some scissors. Here. So now at this point I can undo the stirrup. So I take them up and I twist them up like this. And I do the same with the other side. And then I finish with vet wrap. So what you want is you want these 2 toes right here to be showing. That's the way you can monitor to make sure that the bandage isn't too tight, that they're not swollen. You also want to check the temperature, make sure they're not cold or too hot. You always tell owners just to, when they bring it home, to make sure it doesn't slip and to keep it dry and things like that. And that's how you put on a modified Robert Jones bandage.